Good afternoon. I'm here on behalf of Health Impact Ohio, and I'm here to talk with Durga Mishra. We're going to be talking a little bit about her position today as a CHW, what she does, and I'm going to be asking her a few questions. So I am the Chief Education and Equity Officer at Health Impact Ohio, and it's my honor to be able to work with CHWs like Durga every single day. So Durga, just to get started, will you please introduce yourself and the agency that you work for?
Thank you, Tanikka, for this great opportunity. And I would like to thank all the Impact Health Ohio family for this great opportunity and talking to me about my position and the work that I work with. Well, my name is Durga Mishra. I'm a community health worker, and my current work title is a linkage coordinator working at Ohio State University, Nisonger Center through Ohio Disability and Health Partnership. The project that I'm working with is called a linkage project, which connects people with intellectual and developmental disabilities to accessible health care. This is a CDC, Center for Disease Control and Prevention funded program with a goal of creating a well-connected, healthy community.
Good. Durga, tell me a little bit about what inspired you to become a CHW.
That's a great question, Tanikka, and I'm very happy to express my experience and my inspirations to be a community health worker. During a pandemic, when everything was shut down, one of my senior family members tested positive along with my husband. Despite of having a lot of other health issues, COVID added more mental health issues in the family. No family visitation, isolation, and dying and suffering news from the outside world added a lot of negative impact into that person. I could not withstand that, so I, without any hesitation, enter her room, sit by her bedside, talk to her, and connect her to the other family members. I encourage every family member to tell her about the positive things so that she could stay strong. I stayed with her most of the time, taking care of my 2 years and 7 years old as well. After continuous effort and motivation, 74-year-old was able to win the battle. That was just my family. That's just one of my examples, but there were so many families who were experiencing huge negative impact of COVID during the pandemic. I realized that without any suffering and struggles, our community will not come out of these huge disasters. From then, when I heard about family with COVID, I started calling them, checking them, and asking for what they need. I deliver grocery, food, and any other things that they needed. Without any hesitation, just knock at the door, drop, and check on them. I register for community health worker classes, which could add more resources to, in which I was already working with. Actually, I'm a proud community health worker working hard to bring positive changes in the community.
Awesome, Durga. That's great. I didn't know that. So now tell us a little bit about the current work that you are doing at OSU through the linkage program.
That's a great question, Tanikka. So I'm so happy to express this as well. Nisonger Center gave me a great platform where I can see, meet, and talk to or listen to individuals from wide varieties of discipline. Everyone's experiences are different, especially when I talked or listened to clients. It really melted my heart. Their stories are different. There are just not single or one or two needs that are shared by the clients. My primary role and responsibilities of current position include connecting or linking an individual adult with developmental or intellectual developmental disabilities to the preventive health care and health promotion program in their community. Contacting community partners, County Board of Developmental Disabilities, outreach for program promotion, and collecting resources both side by side. Secondly, I am taking a LEARN classes. LEARN stands for Leadership Education in Neurodevelopmental and Other Related Disabilities, which gives me more accessibility to understand about disabilities and their needs.
Awesome. So when you are working with these clients, are you also connecting them to resources and services? Can you give us an example of maybe a client that you work with and connected to resources and services?
Sure, that's a great question. So I have one example where I can share. That's my success story. Also, I want to tell you. So let me explain this. I am working with the clients. Some of them are midway services, and some are just started. And let me share this story with you today. A client who reached out to me was not from our coverage area. That means from the central Ohio area. When someone reach out to you or come to you thinking about you are the eligible person to seek help, you don't turn away, and I didn't do that either. I talked to the client, follow up multiple times, understood her needs. Client was in need of a primary care doctor who could better understand her disabilities and provide services. I don't think there was any clinic that I didn't call and check with them whether they accept the clients with the disabilities and their accept their Medicaid or whatever the insurance the client have it. And I did it, as that was my great success, that connecting that individuals to the resources that she needed. And she is one of my happy client as well. I have another story to share with you as well. A mother of a disabled child reached out to me who is in desperate need of dental services for her son. I could read the frustration and the hardship that she is trying to get the dental services. I connect them to the dental service at Nisonger Center. And the next day, I got an email from the mom with the big thank that she was able to schedule her son to receive a dental service for the following week. That was my great success. And that client wasn't enrolled in the linkage project. That was the great need that the client needed, but I offered the services if she still wants to enroll and get more services. But I'm waiting to get response from them. But that was the thing that I did it to them, and that make me so proud that I am working as a community health worker, meeting their needs and resources.
Awesome. Awesome, Durga. And those little things really go so far with the families that we serve. So what is one thing you wish the audience knew about your work as a community health worker?
That's a great question. My inner motivation to help this individual to live a healthy life is I would think that my audience should understand me. Everything seems challenging in the beginning, but if you accept this challenge as an opportunity, you will see success everywhere.
Awesome. And my last question for you is, you spoke so eloquently about the challenges that your family faced during COVID. How has it been trying to get people vaccinated during this pandemic? Can you give me an example of anybody that you've helped, or how COVID has impacted your work that you've done since you became a community health worker?
So information is power. So providing information or education to your client is empowering them to stay healthy. I have been working or helping my clients educating about COVID and importance of getting vaccination as I work with them. The first person I work with, like the educating and vaccinating about COVID, is my family member. So I started with my family who was a senior citizen who got COVID and stayed for stop for there for a while. So the second was myself. So if I do not get vaccinated myself, how can I, if I do not protect myself, how I could help others to stay healthy? So second person was myself, helping myself to be protected, to help others protect from the pandemic. So I have a great experience working with immigration population during the pandemic. I used to work with the Us Together, which is a resettlement agency back in Columbus. Pandemic brought many changes and challenges. School turned out into home schools. many workplace shutdowns and in-person work turned out to be like home-based work. Many families lost their job or had to leave the job because of their children, that they need to take care of the children and the families at home. In my experience working with clients during pandemic, every appointment turned into virtual, no in-person visit, limited access to the translated resources to those who have a language barriers about the COVID and the vaccine. Challenges in handling kids and their schoolwork as well added the burden to the family, like that added the increased stress to the family during the pandemic. So those are I had those experiences. I faced that myself, my 7 years being in the second grader, and like he has to stay home, and like he doesn't have like the much knowledge about the internet access, and myself as well. I have to teach him. I have to learn before I taught him. So like that was my great experience that I learned from a COVID. So I myself is one of the example, and I have experience working with the community as well. So those are my great examples and experience working with the community during COVID time.
And Durga, I think you said something that is so profound for CHWs, and that is that it really starts with us, right? It starts with our small circle, your passion, your dedication, your hard work. It all came from your family, yourself, and then it goes out to your community. So we thank you so much for the hard work that you've done. Thank you for taking this time with us, and we wish you the best in your future endeavors.
Thank you, Tanikka, and thank you for having me. It was a great platform, actually. Thank you.
Thank you.